for this practical, I will be showing you how to care of elderly about excretion. Bowel movements can occur 2 to 3 times a day, usually after a meal. The need to go is physically greatest in the first hour after breakfast. So, an established morning bowel care program is recommended. Some patients have incontinence or urgency of bowel or bladder, causing them to hurry to go to the bathroom. For some, this problem can be compounded by mobility impairments that make ambulating to the bathroom or transferring on and off to a toilet or commode challenging. These impairments may be long-standing for the patient or acute changes due to the patient's medical conditions. Medication side effect could even be contributing to the problem. Determine how much help is needed. It's important to first ask whether the person is truly incapable of using the toilet on their own. Everyone should be afforded as much dignity as their circumstances allow, and it is unwise to force help on someone that does not need it. If the elderly person has the minimal mobility needed to complete the task and the mental faculties to use the restroom when needed, then providing toileting assistance should be avoided. Procedure. Tools needed for caring of excretion to the elderly. Gloves, urinal, unisex, bedpan, diaper, cotton cloth, wipes, water, mild soap, potty or commode, basin, and dipper. Matters for attention. First, check if the potty is clean before using it. Second, avoid exposing the patient's body for a long time, causing the patient to catch cold. Third, the bedpan is damp in time and cleanse and disinfect to avoid stains. Fourth, when placing the bedpan to the patient, do not plug it hard to avoid damaging its skin. 5. Only have patient do what they cannot. 6. Do not urge the patient during excretion. 7. Infected patients should be treated in isolation and disinfection principle. Before you approach the patient, wear your gloves and make sure that the tools needed is nearby and accessible to your convenience. Use bedpan in lateral position. Take the patient pants off to the knees and holds the patient with both hands. Turn the patient's shoulders and hips over the side. Recumbent position. Turn to your side. Expose hips. Place a disposable nursing pad under the patient's waist and hip. This one. Put the bedpan on the patient's hip to help the patient recover. Fourth, cover the upper perineum with disposable nursing pad. Fifth, cover the patient. After helping the elderly to excrete, if the patient is in commode or in a toilet, you can use bidet or the dipper to get water to clean their private part, and then use mild soap. Wash the private part properly to avoid infection. Then assist patient to put back their pants. If the patient is bedridden, like for our patient right now, and if they have diaper, get get wipes and 2 basin. This and this basin. And put water to the basin. This. Put water here. And then put water here. Then, after basing the other part,